Welcome to HBF News. Today we are going to eye-bleeding Marburg virus that has recently outbreak in Rwanda. Talk about the eye bleeding. The Marburg virus is a highly virulent pathogen that poses significant health risks, particularly in regions where it emerges. Recently, Rwanda has been facing its first outbreak, with reports indicating that 11 lives have already been lost as of early October 2024. The World Health Organization has declared the outbreak risk as very high within Rwanda, but at a global level, it remains low. As the country grapples with this health crisis, clinical trials for experimental vaccines and treatments are set to begin, highlighting the urgent need for effective responses to curb this deadly virus.
Known for its severe symptoms, the Marburg virus belongs to the same family as the more commonly known Ebola virus, specifically the Filoviridae family. Marburg virus infection leads to hemorrhagic fever, characterized by internal bleeding, high fever, and multi-organ failure. This illness can severely damage blood vessel walls and has a chilling mortality rate, with estimates ranging between 24 and 88%. First identified in 1967 in Germany and Serbia, the virus's name stems from the German town where it was discovered. The average fatality rate for those infected hovers around 50%, marking it as one of the most lethal viral infections known to humans. Symptoms of the Marburg virus typically occur anywhere from 2 to 21 days post-exposure. Early symptoms resemble those of influenza, including fever, headaches, muscle, and joint pain. However, as the disease progresses, more severe symptoms develop, including fatigue, loss of appetite, and bleeding from various body parts. The onset of bleeding can occur within the first week of symptom onset. As noted by infectious disease experts, individuals with weakened immune systems face a heightened risk of severe illness and possible fatality, illustrating the need for heightened vigilance in communities at risk. Transmission of the Marburg virus mainly occurs through direct contact with the bodily fluids of infected individuals, including blood, vomit, and saliva. This raises concerns in healthcare settings or among caregivers who might come into contact with these fluids. In Rwanda, the exact source of the current outbreak remains unclear, but associations with Rhesus bats, known carriers of the virus, have been established in previous outbreaks. Importantly, the virus is not airborne, but contaminated surfaces can remain infectious, emphasizing the need for stringent hygiene measures and safe handling practices. As of the latest updates, Rwanda has confirmed 36 cases of Marburg, with 25 individuals currently receiving care in isolation. The government and health organizations are keenly monitoring the situation, aiming to contain the outbreak while also preparing for potential future incidents. The ongoing clinical trials for vaccines and treatments represent a hopeful step forward in the battle against this alarming virus, highlighting the importance of continued research, public health preparedness, and community education in mitigating the threats posed by infectious diseases like Marburg. Keep watching HBF News.
Keep yourself updated on current headlines. Subscribe to HBF News.
Updated on current events, from politics, business to world affairs, subscribe to HBF.